Nicotine. Nicotine is a family of alkaloids and it is found in tobacco products like cigarettes and other vaping products. The brain loves the feeling that comes from this one, so it's so difficult to stop when someone starts taking it. Continuous intake of nicotine can cause coloring of the teeth, bad breath, chronic cough, and also a rapid increase in blood pressure and heart rate. The worst of it all, it can lead to cancer or lung disease. Caffeine. Caffeine is very popular for its ability to boost energy levels. It can be found in everyday drinks like coffee, tea, and energy drinks. However, regular and excessive usage can lead to dependency, which can, in turn, result in difficulty sleeping, jitteriness, increased heart rate, and stomach upsets. Withdrawal symptoms include incessant headaches and continuous fatigue. Cocaine. Cocaine is a stimulant substance obtained from the coca plant. Users mostly take it by sniffing it with their noses. Cocaine boosts the user's energy and provides intense euphoria, but it also leads to addiction with continuous usage. At the point of addiction, the body begins to experience cardiovascular problems, difficulty in breathing, and sometimes a mental illness that often manifests as mood disturbances. Heroin. Heroin is an opioid drug obtained from morphine. It can intensely induce euphoria and also form a strong bond with the opioid receptors in the brain, binding users to the substance. Sadly, addiction to it has hazardous side effects that can damage vital organs like the kidney and liver. And in extreme cases, it can lead to coma or actual death. Heroin withdrawal symptoms are traceable to muscle pains and sleeplessness. Codeine. Codeine is another opioid medication that binds to the opioid receptors in the brain and spinal cord. It is popular for suppressing pain and cough, and is often prescribed by healthcare professionals only when there is a need for it. That is because when used excessively, it can lead to drowsiness and constipation. The common side effects of codeine usage are dizziness, nausea, and sometimes vomiting. Amphetamines. Amphetamines are stimulant drugs that heighten the alertness and energy levels. Usually, when someone is suffering from attention deficit hyperactivity disorder or ADHD, amphetamines are a go-to prescription. However, they can also be responsible for sleeplessness and lack of appetite. When the body gets used to them, they can lead to intense anxiety, cardiovascular issues, and seizures. Withdrawal symptoms include depression and increased fatigue. Methamphetamine. Methamphetamine, or meth for short, is a substance that is highly addictive and insanely boosts energy and alertness as it affects the dopamine levels of the brain. Meth is usually smoked, injected, or taken orally. Continuous intake of meth can lead to early signs of high blood pressure, sleeplessness, and lack of appetite. And when addiction sets in, hallucinations, memory loss, paranoia, and heart disease are usually experienced. Morphine. Morphine is an analgesic that is really efficient in relieving pain, as it binds to opioid receptors in the brain and other parts of the body to reduce the perception of pain. It is mostly injected or used orally. Morphine can cause drowsiness, nausea, and constipation, and if used for a prolonged period of time, it can lead to difficulty in breathing, decreased blood pressure, and even repeated cases of unconsciousness. Fentanyl. Fentanyl is another pain relief medication that is even stronger than morphine. It is used to manage severe pain and is often used for surgeries. It is usually administered through injections, nasal sprays, or transdermal patches. Fentanyl is highly addictive and can cause severe drowsiness, nausea, and constipation. Additionally, heavy intake of fentanyl can lead to extreme cases of cardiac arrest, coma, or even death. Number 10. Alcohol. Alcohol is a psychoactive substance present in ethanol. It is mostly ingested by drinking beverages with ethanoic content. Alcohol works in the body by depressing the central nervous system, thereby producing an induced feeling of relaxation. In the short term, alcohol can cause slurred speech and coordination impairment, but with continuous and long-term consumption, serious issues like liver damage, increased risks of accidents, and alcohol-related dementia can occur. Ketamine. Ketamine is a dissociative anesthetic, primarily ingested as a pill or injection. It is commonly used for pain relief, but some individuals use it for recreational purposes at parties. Ketamine is capable of disorientation and hallucinations, and addiction to it may result in severe memory loss. MDMA. Molly. MDMA, also known as Molly or ecstasy, is a psychoactive drug that stimulates the body system, thereby enhancing mood and spiking euphoria. It comes mostly in tablet and capsule forms. Just as it spikes euphoria, it does the same to the blood pressure and can also cause blurred vision and dehydration. Continuous heavy dosage can result in memory impairments, sleep disturbances, and mood disorders. Kratom. Kratom is a stimulant or sedative obtained from the kratom tree commonly found in Southeast Asia. It is taken by chewing the leaves, grinding them into powder, or brewing them as tea. Kratom can stimulate the body system and leave a good feeling as it enhances the mood, but it also comes with the risks of nausea, dry mouth, and sometimes constipation with excessive intake. Marijuana. Marijuana, also known as cannabis, contains THC, a psychoactive compound that produces effects of euphoria, enhancement, and relaxation. It is a widely known substance that is either rolled in paper, piped, or even taken as edibles. Yeah, some users spice up their food with marijuana. While marijuana has some medical benefits, prolonged intake can result in red eyes, dry mouth, pumped appetite, and, in more serious cases, temporary or permanent psychosis. Tramadol. Tramadol is a medication usually administered for severe pain. It is used in the form of tablets or capsules. However, overdose or prolonged usage may lead to drowsiness and nausea. It is also capable of causing intermittent seizures and respiratory depression. Ritalin. Ritalin is also known as methylphenidate, and it is mostly used to suppress attention deficit hyperactivity disorder, or ADHD, as it contains a stimulant that reduces impulsivity while increasing focus. Its side effects may include decreased appetite, severe headaches, sleeplessness, and sometimes increased heart rate. Hydromorphone. Hydromorphone is derived from morphine and also acts on opioid receptors in the brain. It is used to manage severe pain, but if overused, it can cause drowsiness, constipation, and nausea. Khat. Khat is a body-stimulating plant mostly found in the Eastern African region. The leaves contain cathinone and caffeine, which can induce high levels of energy and euphoria, but can also expose the user to sleeplessness, high blood pressure, and in worst cases, psychological imbalance. Meperidine. Meperidine is also known as pethidine. It is used to combat severe pain, mostly in cases of labor or post-surgical pain. Meperidine has the tendency to build up toxic metabolites in the body, thereby causing constipation and nausea. Methadone. Methadone is a synthetic opioid, also used to manage severe pain. Only that its pain relief weakens the body, especially the joints, making it dangerous to do anything that requires mental alertness, like driving or operating machines. This is because it nauseates the user and also causes drowsiness. Zopiclone. In severe cases of insomnia, Zopiclone is a temporary go-to medication intended to fix sleeplessness. Tapentadol. Tapentadol is a potent medication for severe pain, but not recommended for anyone with liver issues, as it is also strong enough to knock out the body system and cause drowsiness. If used for a prolonged time, it can result in respiratory depression and addiction. Aripiprazole. Aripiprazole is an antipsychotic medication used in the treatment of issues like bipolar disorder and schizophrenia. It helps to balance some chemicals in the brain and stabilizes a disorderly system. However, continuous usage can lead to addiction and result in weight gain to start with, and in worse cases, it leads to disorderly movements and exposure to suicidal thoughts. Pregabalin. Pregabalin is a medication used to treat epilepsy and anxiety disorders. It basically reduces the level of electrical activity in the brain, but the continuous usage of pregabalin can lead to addiction, which can cause difficulty concentrating and blurry vision. Vyvanse. Vyvanse is a medication used to treat binge eating disorder and attention deficit hyperactivity disorder. It contains lisdexamfetamine, which stimulates the central nervous system. However, it can be addictive with continuous usage and can lead to a lack of sleep, anxiety, and increased heart rate. Meperidine. Meperidine is a body-stimulating substance that mostly comes in white powder or capsules. It belongs to the same group as amphetamine and cathinone and has been declared illegal in many countries in the world because of its toxicity and exposure of addicts to anxiety, hallucinations, and restlessness. Gabapentin. Gabapentin is mainly used to control nerve pains and seizures, as it affects brain chemicals that are responsible for sending pain signals to the body. The issue with gabapentin is its addictive nature. It exposes the user to blurred vision, lack of coordination, and severe mood swings with prolonged dependence on it. Olanzapine. Olanzapine is an antipsychotic medication used to treat bipolar disorder. However, it is associated with metabolic changes that affect blood sugar levels and lipid profiles, leading to a higher risk of obesity and diabetes. It can also increase the level of cholesterol in the body and cause sight impairments. Barbiturates. Barbiturates are a class of sedative hypnotic drugs that depress the central nervous system to control seizures, anxiety, and insomnia. They have a high level of addiction probability and can cause confusion, impaired coordination, and dizziness, among other side effects. Alprazolam. Alprazolam is a medication that belongs to the class of benzodiazepines, commonly prescribed for anxiety and panic disorders. It enhances the effects of GABA, a neurotransmitter in the brain. Good as it is highly addictive and can cause a lack of coordination and gradual memory loss. If you like this video, give it a like and hit the subscribe button for more.